thank you for coming. Thank you to the media for coming also. Joe DiStefano, Mayor of the City of Middletown, and we're here today to talk about some sad news and some great news. First, I'd like to introduce some of the elected officials here today. Council President Miguel Rodriguez, Alderman in the 1st Ward Joe Massey, Alderman in the 2nd Ward Jerry Kleiner, and Rachel from Alien Gunther's office. We want to thank you for coming down from Sullivan County. And if I missed anybody, please let me know. I'm also here with Tony Danza, who is the real Tony Danza from Middletown, property owner of the Horton Complex, of which we're in, and also Teresa Butler with the Middletown Community Health Center. And the reason for the press conference, and you had a little bit of a teaser last week in the newspaper, is that well over a year ago, we gathered on Lau Avenue to talk about and to introduce an exciting project for Middletown, the Middletown community and the region in regards to not only healthcare but historic preservation. And that was the restoration of the O&W station on Lau Avenue and to historic standards. It was a massive project. We all knew that at the time. The Middletown Community Health Center took on the project. The city transferred the property to them for $1 with development goals to be met. And unfortunately, due to a number of things, one being the increasing cost of the renovation and the lack of support on the federal end from the funding, we were unable to do that, or they were unable to do that. We were fortunate to receive, or they were fortunate to receive, approximately $2.15 million from the State Regional Economic Development Council to pursue the remediation environmental issues on the building, and that was $500,000, and $1.65 million for other related projects to the development of the O&W facility. That being said, they also applied for, I believe, $7.9 million through the federal government program called DSRIP, and we were hoping to hear, or they were hoping to hear in October, and they just recently heard that that grant application was unsuccessful. Senator Schumer was here also back then. We were talking about historic tax credits and new market tax credits, but unfortunately the increasing costs and the problems with the building being vacant for so long, the fire damage and all the other damage related to the building, it's not feasible to move ahead with that project. The historic renovation side of it is important to our community. We realize that, and we're going to continue to pursue, working with the Middletown Community Health Center, other options that could preserve possibly as much of the building as possible. But I don't want to mislead anyone who's interested in the historic part of it, that there is a possibility that the building will have to be demolished at some point if we're not successful. But that's just a building. What's more important is the reasons for the Middletown Community Health Center purchasing the building, and that was to expand services, and the healthcare indicators in this area are still very low. I believe there's an article in the paper today about Sullivan County being number 2 in the state, the worst health indicators. So the mission of the Middletown Community Health Center had to move on. When there was an indication that we may not be successful, Teresa, of course, as a good CEO would do, was started to look at other options and explore other opportunities for the health center. And one of those opportunities was to possibly come up here to the Horton Campus and discuss with Touro College an opportunity to have a relationship between the Middletown Community Health Center in Touro within one facility. And that's what we're here today to announce, is that they have put together a cooperative agreement, an agreement to move forward, and an agreement to hopefully work together, but I'll let them address the specifics of that. So I'll bring Teresa up first to talk about their plans and whatever she'd like to say about the other plans. Teresa?
Good morning, everybody. Thank you so much for coming. We really appreciate your attendance. These are very important projects that we're talking about. I would also as well like to introduce, I have a number of my staff with me, including Dr. Lanza, my medical director. I have a board member with me. Stephanie is here as well. And many of our staff, our clinical staff and our support staff. The O&W project is very near and dear to Middletown. We've been holding on to it for a very long time. Not to say we're going to release it at this point. We're still going to explore options. But I must say we have really explored many of grant opportunities We have really thrown ourselves into the arena there, but unsuccessful at this point. But you never know what's going to happen going forward. The partnership with Touro has been wonderful. We have had their medical students come to our locations to do clinical rotations, which we want to continue. They are continuing, it's growing. Touro is a beautiful facility for our community, and we are very excited to partner with them. We are going to be taking over a nice portion of the building, which was a hospital, so the rooms are really big, and expanded services for Middletown will be addressed here as well. We could bring on new programs. The buildings in Middletown that we might be vacating, we'll repurpose them from other means. But we are an expanding, growing organization. You know the healthcare arena is changing, the landscape is expanding, and we need to do our part to address some of the needs and issues in our own community. And that's what we're doing by partnering with Touro. They have been wonderful partners, and we can't wait to come up here, as well as continue to stay in our community and expand the buildings that we have presently. We know that there's a lot of healthcare needs in the community. We have also just built a brand new dental van. We know dental is a big issue. We know that cardiology, and as the mayor had said this morning, there was a great article on the news in reference to the health of our community. Bordering communities being so unhealthy is something that we need to address as well. So we're going to explore and move on to different arenas and see where we can address some of the needs. But one of the first things we need to do is to address the moving from the O&W focus at this point to Touro. So we will be bringing you update timelines of how we're going to accomplish this, but at least we have some funding in place to do it. So we thank you again for your attendance, and I'm sure that I would like to also have maybe our medical director give you a little bit of insight of who we are and how we address some of the healthcare needs. Dr. Lanza?
Hello, my name is I'm Dr. Lanza. I'm the medical director for Middletown Community Health Center. I'm also practicing OBGYN. I've been in the community now for about 6 years, almost 7 years. I started off as an OBGYN, and then when the opportunity came to be the chief medical officer, I went ahead and took the chance. Even though I'm kind of young, I said, let me get involved into it because I really like community health. Middletown has really grown over the past few years. Again, we are primary care based. We do internal medicine, pediatrics, women's health. We do podiatry, dental, and we also have a nutritionist, behavioral health, and then we're also working on expanding our behavioral health services to the community and in Port Jervis. We have about 9-10 locations if you include our dental van and our administrative building. We do a lot of great work with Touro. We have their medical students come in, do their third-year medical rotations with us. We have their first and second-year med students doing some clinical following our providers also. And we're hoping to get a little bit more involved with the Touro Medical School as far as more clinical teaching. I think community health is a really plus for the students. A lot of students leave medical schools basically learning more about private practice. All they hear about is private practice. They don't really hear too much about community health. And community health is really where it's at, because again, we're all serving each other for one, and we're trying to make a healthy community. We're doing a lot of screening programs. We're going to participate with the students with screening programs. We're going to participate with the students with emergency preparedness, and then hopefully the relationship will grow, and it'll be so well involved and convoluted that you'll be able to see it almost will be streamless between both programs. So I'm really looking forward to this. Thank you.
Tony Danza?
I'm the real Tony Danza. It gives us an opportunity to make this property grow. Under it all is the land. This property serviced this community for 90 years with doctors and medical care. Now it's going into another stage. Teresa brings so much to the table. It creates jobs, it creates health care. We're working on the lease. Everything is agreed to, and I'm sure it's going to happen. But things like this don't happen without the help of the Mayor DeStefano and Marie Bruni, the head of economic development. They pitch in. They're there to make it happen, and that's what makes this community grow. There was a possibility that this hospital was going to go vacant and be a big white elephant. Well, that's not going to happen. It's going to service this community for the next 90 years, I'm sure, especially with wonderful people like this and the wonderful people at Touro. Dr. Steyer, the founding dean, and Dr. Camerata, the chief operating officer, are amazing people, and they bring so much to the table and so much to this community. Just look forward. I think it's going to be something very special. Thank you.
Gary? Thank you, Tony. Dr. Camerata, say a few words.
Thank you, Mayor, and thank you, Tony. It sounds a little bit like the marriage today, and the reason why we're here is because it is Middletown Community Health Center and Touro College. Actually, we both will be tenants in this very, very beautiful building that Tony Danza has given us. And it is because of this building that we will be able to partner and I think do outstanding things above and beyond what is already being done. And this is all happening because of our absolutely outstanding faculty that we have here. And without this faculty, our students would not have the competency that they are now providing the community in the form of shadowing and in the form of doing their clinical rotations. We will be able to expand that by having the Community Health Center here on campus. It will be a benefit to us, it'll be a benefit to the community, and I think it will be a benefit to demonstrate how a facility like this can grow and how through a marketing program we actually can expand it with even other kinds of resources that can be developed to serve this community. So it's a great time for Touro today, a great time for the Horton Complex, and I hope it's a great time for the people of Middletown to re-experience the repurposing of this building and the great things that we are doing now and the great things that we can do in the future. So thank you, Mr. Mayor, and thank you, Tony.
Before questions, I believe it's about 40,000 square feet you'll be taking? Yeah. So it's about a 40,000 square foot. Is it the Camillo section, which was right over here to our left?